Dawn.
Dawn.
Carla and Dawn are their names.
So, camera's on.
Thank you. Wow, testing.
Got to check.
Patrick stopped asking me to test the microphones when I started singing.
I can see that.
I would make a comment that I heard after our last meeting, people would appreciate it if we would keep the microphones in front of us instead of...
So you can hear?
So I put them all down to the same spot today.
I already moved mine.
People can hear you. People can hear you.
People can hear him. And don't lean into it and like Brady does.
Thanks, Brady.
Morning. It is a cold day, isn't it?
It is. Well, and it could be a rain day.
Could be. We've had enough.
Hi, Jim. Here's your supplemental pile.
Oh, thanks.
Yeah, I heard you. Okay.
Yeah. Get queued up. Pulses. There we go. I know what you're doing. Bingo. All right, it is 8:30, and this is the Public Health and Human Services Board meeting on August 28th, 2018. For those of you watching and in our audience, the month of August is a little kittywampus. We moved a few things around, so I know some of you might not remember that today is the public health meeting because we didn't have it last week, so just a reminder. So don't turn off your camera or your computer. Continue watching us because this is good information for you. And we will call the meeting to order, and we have introduction of new staff, and we also have a lot of our public health staff here right now, not all of them, but a lot of them. So let's start with the introduction.
Well, I am excited and just honored to get to introduce our newest staff person, Diana White. She will be taking the position that Beth Ferrone is leaving behind when she retires at the end of September. So Diana comes to us with a wealth of experience in social services. She graduated from the University of Wisconsin-Madison with a Bachelor of Science and received a Master's of Social Work degree from Eastern Washington University, Spokane. She was awarded a fellowship from Portland State University Public Administration and Policy Program to pursue a doctorate degree in ethics and policy development, focusing on aging populations. She's held many positions in not-for-profit and other agencies, doing work, grant writing. She's written a multitude of grants, brought in thousands and thousands of dollars for different organizations. We're just very lucky to have her. So just excited to welcome Diana.
Hi, Diana. Welcome to the team.
I'm really pleased, thank you. I've been here, this is my second week now, and I must say the staff at Public Health and Human Services are just wonderful. Very helpful, friendly, such a good culture. The environment is wonderful. And I'm pleased also that my background includes working for Native Regional Health Corporations in Alaska, in Sitka and Bethel, as well as working for state and county government, federal government. My last job was working at St. Croix Chippewa Indians of Wisconsin, where I did research and grant writing and planning. I moved here in January 2017. My husband passed away shortly before that, and we honeymooned up here and vacationed a lot, so it had such good memories for me. I thought I would move up here, so I've been up here fenced in with my old golden retriever. Nice to meet you all.
Thank you so much for coming.
Welcome.
and
You, welcome, welcome.
What a great opportunity for you to partner with Beth before she leaves. We don't always get that luxury, so
I know, it's very nice. Thank you.
yes, thank you.
Awesome.
Okay, we will move on to the consent agenda. Does anyone want to pull anything? Can I get a motion to approve?
So move.
Support?
Any opposed? All in favor?
Aye.
Passes. All righty, let's go into the fun stuff. Thanks, Martina.
Yes.
If the public wants to see what's on the screen here, you're welcome to move up a little closer, and feel free to pull the table out too if you'd like, or you can just sit right at this desk over here.
Good morning. Lori and I are pleased to share with you our 2019 preliminary budget this morning for Public Health and Human Services. We'll be taking somewhat of a team approach here to the presentation. I'll start out with our mission, what guides our work in Public Health and Human Services. Our mission statement was crafted by PHHS staff in 2014. And this, with a lot of feedback and discussion, this is the mission statement that we came up with. It's supporting the health, safety, and well-being of our community. Public Health and Human Services is an integrated agency, meaning we have both public health and human services, which is such a strength for us as a small agency. And this next paragraph here really reflects that as an agency, we are responsible for the administration of many state and federal programs that provide support for those in need and promote and protect the health of all residents. And I promise that's the last time I will read right off the slide. So these are some of our service areas. A lot of you know that already, but this is just a snapshot of the various services that we provide across social services, human services, chemical dependency and child support, which are delivered through contract agreements, financial assistance and healthcare programs, and of course public health programs. This is our organizational chart. I recognize that you probably can't see it from here, so you should have a copy printed as well. A couple things that I want to point out here on our organizational chart is we've added a lot of information up in the upper left-hand corner to reflect the many contracted providers that we work with to deliver public health and human services in the community. That includes Wilderness Outpatient Chemical Dependency Treatment Program, In-Home Support Program, HDC, the Human Development Center, which we work with to provide mental health services, AEOA, Employment and Training, Sawtooth Mountain Clinic, Outreach Services, WIC, Child and Teen Checkup Services, Carlton County Child Support, and North Shore Home Care. And the reason we felt it important to reflect those here in this org chart is because in some cases those responsibilities would fall back on our agency, so they truly are a part of the big picture of our organization and the services that we provide. An additional layer of this chart here that isn't visible is the fact that we have oversight from the state and federal governments in the majority of programs we provide. This graph here is representing the cost of services in public health and human services. In blue, about 36% is direct program costs. These include services like foster care placements. That's one of the larger portions of our budget in public health and human services. It includes purchased and contracted services. It also includes the Public Health Community Fund, which for the 2019 budget year was moved from the general fund to Public Health and Human Services. And I'll say a little bit more about that later. As you can see, In red, personnel is our largest expense, which makes sense for us as an agency. We're people, serving people. Lori had a pretty funny metaphor for that. I don't know if you want to share that, Lori.
Just looking back at the highway department presentation, and then I looked at ours and I said, oh my gosh, personnel is our huge expense. And then I remembered, well, we don't buy dump trucks. We are personnel.
Right.
This is what we are.
You are the dump trucks? Is that what you're trying to say?
Pay to them for the product.
So in green, services and charges, those are things like the software licenses that we have to purchase for our various electronic health records. That also includes staff training and travel and other administrative costs like phones and computer equipment. Supplies is a very small, at 1%, less than 1% of the total expense budget. This is our revenue sources for 2019 proposed budget. The county levy in that lighter blue shade at 60% is the greatest source of revenue for our agency. Over half state and federal reimbursement combined make up about a third of our revenue. And then in green are things like fee for service. Those are reimbursements that our agency receives from private health insurance. And something that we see for 2019 is really potential for growth in that area as we've strengthened our fiscal team and have greater capacity to pursue all of the revenue that we could as an agency now that we're fully staffed and training in that area. And I'll say more too as we move along about the balance between county levy and the reimbursement sources for our agency. This graph breaks down programs and services as a total percent of budget by program area. Social services at 65% is the greatest percent of our budget, and that's where we have the greatest number of staff. So that again just makes sense to see that reflected here. And again, this is just a snapshot of the programs. There are many more services within each of those program areas, but these are some of the larger expenses. This graph here shows the cost of services in a 3-year trend. In green is the 2017 actual expenses to our agency. In red is the 2018 budget, and in blue is the 2019 proposed budget. And then we're just partway through the third quarter of 2018, so we don't have year-end actual data and are showing the 2018 budget here. There's some slight growth in the services and charges and more significant growth in personnel costs. This is due in part to the new salary structure that was approved for 2018. Our department was impacted by that because we are a larger department and we have a number of staff with longevity in our department as well. This also includes one new FTE for 2019 in our initial budget, and I'll say more about that as we go forward. This graph here, I think it really tells a story. This is our revenue history over the last 4 years. You can see in blue that the county levy has increased for our department. And then in red, PHHS revenue. Those are revenue sources from state and federal areas. So you can see that's remained quite stagnant despite the growth in our department, the growth in the people we're serving, and the growth in our staff. This also does include that public health community fund, that approximately $130,000 that will be shifted from the general fund to PHHS's budget. And then just to put some context around those numbers, I wanted to share this graph with you again that shows the growth in our Minnesota healthcare program caseloads. At the very bottom is the baseline here for these purposes is 2013. As you can see in July, for example, of 2013, 302 cases or households in Cook County that are receiving Minnesota healthcare programs. That includes medical assistance, Medicare savings programs, and at this point in time, or at least as recent as we have the data available in July, 616. So we remain at about double the level of enrollment in Minnesota healthcare programs in the community. And two, these are cases or households. These aren't individual persons. So in an individual case, it could be one person or it could be a family. And we were able to get the number. The current enrollment for the Minnesota healthcare programs in Cook County is 1,059 individual people. And again, we're just presenting this here today to demonstrate why our costs and services have increased over the last 5 years.
How do we compare to other counties?
It's pretty much across the board in Minnesota, similar growth in healthcare programs. And again, increased access to healthcare programs has increased access to other services that we provide as an agency as well. So that's not felt just within the income maintenance or healthcare area of our agency. This diagram here shows our historical fund balance at year end, beginning in 2007 through 2017, and in that lighter blue is what's anticipated for 2018. And again, I think this really tells a story as well, that we've grown as a department but haven't levied or budgeted for that growth, and it has been coming out of our fund balance. We did add to the fund balance in 2017, but we are projecting a decrease in the fund balance for 2018, and that's due in part to that new salary structure that wasn't levied for the 2018 budget. Lori did some research with the state auditor's office, is that right, Lori, to find out what the recommended fund balance is for an agency. And the state recommends that we have 30 to 55% of our operating costs, and correct me if I'm saying this wrong, Lori, in our fund balance, or no less than 5 months of operating costs. Currently, we have a 2-month buffer in our fund balance. So at approximately $4 million budget, we have less than $700,000 in fund balance.
What's the dollar amount we should have to be at 30% or 5 months?
About 1.4 million.
1.4.
1.4 to 2 at 30 to 50,000.
So we're
And again, the importance of having a healthy fund balance is that it's a safety net against unbudgeted expenses, catastrophic events, state shutdowns, or unanticipated costs. 2019 budget changes. So among the most significant changes for our department for the proposed 2019 budget is the public health community grants. That's again, approximately $130,000, formerly known as non-mandated levies, that were moved under the Public Health and Human Services budget. These are funds that support Public Health and Human Services mission, and not that dissimilar from the organizational chart that I shared at the beginning. Those are services that we're using our funds to leverage with other county partners to provide services that support the community, that support the work that we do as an agency. Another change for the 2019 budget is we're proposing an additional support staff person in social services. This would be a full-time case aide. We are representing this in the 2019 budget as we see potential for additional revenue and efficiencies in that area. We're trying to be proactive with this request by putting it into the 2019 budget. We don't have all of the duties mapped out for that position, or how duties would be assigned. We aren't prepared to bring that to you to fill the position at this point, but we want to put it in our 2019 budget so that we have the ability to add that staff person in 2019. Some of the motivations for adding the staff person is we see opportunity to provide additional support to the social workers and some of the more administrative tasks that they're performing. that could free up their time so they can spend more time with the people they serve. There's also, we just received notification from the state that the state plan amendment was approved by CMS, which is the Center for Medicaid and Medicare Services. And this is related to additional programming for substance use disorders. One of the services that was approved as a part of this change is something called treatment coordination, and it's a funding source and it's a revenue generating position for agencies to help guide people through the treatment process. And that's something we're already doing as an agency. Our staff work closely with Greg Lanier and the outpatient treatment program to help people access treatment and refer to other services, but we don't have a revenue source for that, or we aren't currently receiving revenue for that. This is a brand new funding source in the state of Minnesota. So that's one of the things that we see as potential for this position. We don't have the capacity currently with our support staff to take on that service. There were also budgeted staff positions that were budgeted in 2018 that weren't added, one of those being the second public health position. We had budgeted for 2 public health nurses in 2018, and as we've been working with the Sawtooth Mountain Clinic to talk about transitioning the family home visiting program, that position has remained vacant, but again, that was in our 2018 budget. It is in our 2019 budget as well. Additional staff that was budgeted in 2018 but wasn't filled because of being dependent on other transitions was the backfilling of an income maintenance staff position, and that is Pat Strand's part-time income maintenance position. We had budgeted for that to increase to 40 hours a week, pending her transition to full-time VSO. So again, we're representing that in our 2019 budget. That isn't a change from 2018. This is the number of children's out-of-home placements over the last 5 years. And again, we've included this here to just demonstrate that budgeting for unknowns is a challenge. We can't anticipate well, we can to an extent, but we can't anticipate exactly what will happen, what a family might be going through, or an individual child, or who might be moving into the community, or what existing community members might be going through in a given year. But we make our best estimation based on current caseloads, working closely with Grace, our Children's and Family Services supervisor, who couldn't be here today, but looking at rate changes going into the next year, current caseloads, and just projecting for some unknowns. So more on the unknowns and looking ahead, I mentioned rate changes. We're still receiving rates from DHS. We don't have all of the reimbursement rates yet for 2019. In some cases, we're just continuing to budget 2018 rent rates until we receive the exact figures. Out-of-home placement is our greatest area of expense. And again, we budget that based on known placements and some historical trend information. Mental health placements for adults are another area where significant expenses can't always be anticipated. And again, the importance of having a healthy fund balance. Just one unanticipated placement in either of those areas could significantly deplete our fund balance. Another big transition looking ahead is in public health, recruiting, training new public health staff as we look towards Joni's transition out of employment with the county, and then the potential transition of the family home visiting program. Again, we are budgeting for 2 nurses in public health for 2019 until we know for certain that we're moving forward with that transition, just so that we have that in our budget. We are committed to continuing to deliver those services as an agency. Costs associated with staff turnover. So This is another reason to have a healthy fund balance, is to have the ability to and have the funds to recruit and to support new staff as we're bringing on new staff, and that when someone leaves, they're leaving with a lot of institutional knowledge, and it takes more time to bring new staff up to speed. But because of our remote location, we aren't always bringing on staff who have experience in a field. Sometimes we are, and that's great, but there are more training costs associated with staff turnover. We also have a new governor coming on in 2019, and knowing that could bring a lot of changes for our department as well. Looking back at 2013, 2014, and the governor's task force around child welfare, that brought a lot of changes for our agency, and just not being able to anticipate what that might hold based on the election or the direction that the governor will take going into 2019 and 2020. Opportunities to increase revenue and improve service delivery. I just wanted to share this as a success for our agency over the last year, as we've become more stable in staffing and have had supervisors who are able to pursue new funding options. An example of that being Martina and Julie in pursuing that innovation grant to support people in the community with disabilities and finding employment. Again, just to demonstrate why stability in our agency can be of great value to the community when we can pursue additional sources and additional funding. And that when supervisors are working with staff rather than carrying a caseload, they're really working with their staff to ensure that maximum revenue and bringing that back into the agency. So this is the snapshot of our 2019 preliminary budget. You should have a more readable copy in front of you. This also went out with the agenda packets. Lori made some adjustments to the wording at the bottom in that rectangle, but the numbers are all the same. That 91% increase in public health reflects that public health community funding expense that was moved from the general budget. We're a small department, so that almost doubles the expenses for public health, so that looks like a big increase. And we are not projecting to use any fund balance in 2019. Our levy request is $2.5 million, and as you can see in this zoomed in snapshot, that 2.5 is what covers the difference between our expenses and our revenue. Revenue is projected to increase by 2%. Expenditures are projected to increase by 6%, and this includes that community health fund. Without that additional expense being moved to PHHS, our projected expenditures would increase by 3.37%. The requested levy is 16.6% higher than the 2018 budget, and that 2018 budget did not include the additional personnel costs that were associated with the contract negotiations. So again, that's why we had to dip into the fund balance and then had a revised budget once those costs were factored in. Again, our mission statement, supporting the health, safety, and well-being of the community, and just wanted to thank you, commissioners, for your continued support for PHHS and by committing to sustain these services you're supporting and investing in a healthier community, so thank you. And if you have any questions, Lori and I, or some of our subject matter experts, supervisors behind us are on hand to address any questions you might have about our 2019 budget proposal.
Does anyone have questions? Jerry?
Thank you, Madam Chair. I don't have questions, but I just want to commend you for holding tight to a sustainable budget, and I understand your requests and particularly in the staffing area. It does make sense. It's all the work that we've been doing for the last few years has been toward creating a sustainable staff in public health and human services, and I think your budget reflects that, and the work that you're doing reflects that. And so to bring in another person who can support the agency and getting more revenue and creating increased sustainability, not growth really, but sustainability is our key. I think you've done a good job of that and reflecting the community things that have gone into your budget. And maybe my question would be, can you get more specific about what those are? I kind of remember what those are, but just for all of us here to know what those are.
Yes, so historically, these were funds that came out of the general fund to support agencies like the Senior Center, for example. Joni helped me out here, was the Violence Prevention Center, Legal Aid, Volunteer Attorney Program. So again, these are organizations in the community that are really in line with our mission, and that this is a change for 2019 in that we are working with our Public Health and Human Services Advisory Committee to review those grant requests, and that we hope that we can potentially grow that in some ways, or continue to work with agency partners to see are there opportunities for innovation, for new requests, for people who have a good idea and with some county support could leverage their funds to again support our mission and the people we serve.
So historically, to add a little more context,
Yeah,
in 2015, the discretionary grant process include all of these things that we've pulled out that have a public health component to them, and the arts and culture requests, which we're dealing with through the budget committee. And the amount of money set aside for that was up to 3% of the previous year's levy. And then it went to up to 2% of the previous year's levy, and then last year we cut 10% off of it. So if we were to look at that model, the amount of money that is going into those grants, 9, 2, 4, 6, 1, 2, 3, 145. We're at 1.5% of last year's levy is what we're allocating, and most of that is going to public health. And the metric, the reason for having a subset of the Public Health and Human Service Advisory Committee review these requests is they're the ones who understand the impact that those services have in our community. They're also the ones who, if those services weren't being contracted for, would have to make them up within the agency. And so it's better to have them reviewed and the recommendations there. And the goal is not to grow that program. The goal is to meet our community needs in advance of them becoming a crisis, in advance of them becoming an acute situation, by providing public health interventions before they become costly human service interventions. So just a quick reminder, at this year, according to where we're at, we have up to $130,000 set aside towards these public health grants, and we've reduced the amount in the arts and culture grants down to $15,000. So of a $9.2 million levy, that's less than 1.5%. So last year, we actually had the review committee look at those grants and make a recommendation. This year, we moved that amount of money into the public health, out of the general fund into the public health. And that's why Allison's having to show the increase that they're asking for is not necessarily all the increase that they're asking for, but it's also showing an accounting change. So just to put that in context. So a couple of the other programs that are supported by that historically have been the summer child programs, summer youth programs through in the West End and here in town. So.
Go ahead. So just one more comment, or not really a question. So, we talk a lot about sustainability, but I think what we're really trying to do, the reason we want sustainability is so that we can really get at prevention, which is what we're making all these changes for, so that we can really, as Jeff so well said, take it out of public, or use the public health money to prevent the human service expense later. So I think that's a wise thing for us to be working toward.
Thank you, Madam Chair. So I appreciate all this good work. However, I would ask that the first PowerPoints that you presented until you got to the actual page that we have in our packet, could you have that printed out? Because Commissioner Bersheim and I are on the Budget Committee, and we have 5 new members of the Budget Committee, and I think that kind of shows the graphs and all that shows a much more comprehensive picture. I mean, these are all good facts and resources here, but would that be possible?
We could have it shared to our website along with the budget packets or the
That's a great idea.
presentation packets.
Madam Chair and Commissioners, I would just let you know that on the county website, under Cook County/budget, right now, all of the budget summaries and details that are presented to the board and/or to the Budget Committee are available, and they have been since Friday. And that today we'll add the Health and Human Services materials to that, so they'll all be publicly available.
Okay.
And then I know that this afternoon, Valerie is going to put out a notice of a reminder of the Budget Committee meetings, or the budget meetings, town hall meetings coming up, and then a reminder that these materials are all available on the website. So, and of course, if anybody wants a printed copy, they can ask anywhere, because they'll be on the website and we can make those available to people.
Okay, thank you.
Myron?
Well, thanks to you and your staff for your work, and it seems to be a reasonable budget and sustainable. And just following up with sustainable, I know it's sort of a, looking into the fuzzy ball of the future, but as we move forward, in the years and taking all those unknowns, which I'm aware of, do you feel like this is somewhat of a sustainable thing? If, all things remain the same? I guess that'd be the best way to phrase it, considering the changes with state funding and
It's
all
unknown
that.
sustainable.
Do you feel, I guess another way to ask the question, with this proposed change in staffing, do you think that's a sustainable staffing kind of allocation that we can keep moving forward with?
It's certainly our best estimation at a sustainable staffing model. Again, there are many unknowns.
Right.
But we need to balance the impact on the public. Our staff are almost all taxpayers as well, so we feel it too when there's a levy increase. So we need to balance what we see as the need in the community and the opportunity to improve our service delivery and find efficiencies by having a sustainable staffing level. But again, by sharing some of those unknowns, I just want to be really clear with all of you as to why we need to sustain that fund balance. And we can't do that in 1 year, but we can continue to build on that, to strengthen our fund balance, to help prevent against unknown significant impacts to our budget.
And by, not projecting $155,000, dip into the fund balance, you feel like you've got a little bit of correction there in order to move forward, because I'm fully aware that that's not really a good, ideal situation, and appreciate your efforts with that. So how much, is it about $155,000 that you've sort of added to this to get to the point where you're not going to dip into a fund balance? How much would that be, theoretically or whatever? What did it take to make that correction?
We never actually, we're not looking to dip into the fund balance. That $155,000 that you're looking at for 2018,
Yeah.
the 2018 budget was approved at the end of 2017, but the new salary structure with the new with the contract
That was
negotiations,
that amount.
that didn't come about until after the budget was approved.
Okay.
And so that's where that $155,000
Okay.
difference came from.
All right, thank you then.
Yeah.
clarifies
So
that
the
for me.
2019 budget is including the new salary structure that was
That
That was
makes
approved
the
last year.
correction to, yes,
correct.
which, thank you, I got it.
Bobby?
How much is this affecting the whole county levy? Because I think we were at like 8% or something.
Yeah.
What portion of this is that?
Let me
It's higher math.
pull it up.
Percentage of the percentage.
It's on that one sheet that.
Yeah.
Yep. At this point in time, the major funds, the general fund is showing a 12.5% increase in levy from 18, the 19 request. The highway is showing a 2.5% increase over their request from 18. And Health and Human Services is showing a 16% increase. Now, again, you have to do some adjustments because we're not showing the YMCA in this line. It's going up into the general fund. When you make those adjustments, it all comes down to, at this point, it shows 8.1, but we know we've already made corrections that bring it to 7.8 for an overall levy increase.
But what portion is this? Is this
16.
1.5% of that?
So the overall levy request, or the 18 final levy was 9.2 million, and Health and Human Services is 2.2 million, and the highway is 2.2 million, and the general fund is 4 million. So roughly, if you look at that big ball, about 50% is general, and then 25% is Health and Human Services, and 25% is highway, when you look at what we're spending our money on.
Does that answer it?
Still looking for the percentage. Still looking for the percentage of the percentage.
What's the number
Yeah.
that you're actually looking for?
Yeah.
If the
Of the
increase is
total
8%,
increase.
what of that 8% is public health?
You know, do we need this extra
So,
job here?
I'm sorry, of the 8%, that's representing a dollar increase of $750,000 from last year. And Health and Human Services is showing $365,000, so that's about half of the half of the levy increase for the year in dollars. About 50% of the levy increase is carried by this request from Health and Human Services.
That's the number
That's
you
what I
want.
was looking
Yeah.
for.
Okay.
That's the number you're looking for.
Yeah, 356, about
So
40.
We don't have to approve those positions, and those positions have been put on
Because
hold.
it's 92,000 a point.
Yep.
$92,000 for a point, correct. And so 365 is about 45% of the 750 total requested new levy this year.
That's what I was.
Okay, all right.
Well, I can tell you that I don't miss the days when we had 4 to 6 staff in here in tears, just begging for a little bit of relief in order to have the support in their office to provide the services that we need to provide. And unlike any other department that we have, you are completely driven by the needs of the community. And it is needs, it's not wants. It's needs. And I hope to God there's never a day that we have to tell someone in need no because we don't have the staff.
There was an article, a timely article in the MACA News, which is the Association of County Administrators, and Beltrami County is looking at a $3 million deficit annually in their out-of-home placement costs. Just their out-of-home placement costs.
Wow.
So,
St. Louis County's at 21 million this year.
yeah, I mean.
An out-of-home placement?
Yeah.
Just an out-of-home?
So the question about
Average, I
the
think.
question about the trends and the expenditures and the uses, those are very good questions, because that's what I ask Allison to keep an eye on, is how are we comparing to the 7 counties that, we belong to, and how does that look? And when we look, Lake County, we're half their size, so they're spending twice as much. When we look at Carlton County, they're 4 times our size, and their staff is, the models really just continue to grow based on population and based on budget, and they do. And in that sense, even though there are very few economies of scale as small as we are, the model holds out really well, which simply says that our staff are doing a lot very efficiently. And again, the biggest driver, when you look at budgeted revenue growing by 1.9% and budgeted expenditures, take out that $130,000 and budgeted expenditures are growing by 3.5%. So there's 1.5% on $4 million gap every year. And and that's why going to the Association of Minnesota Counties and lobbying for better shared services agreements and better ratios in cost sharing from federal and state agencies is why we have to be at the table. All of the lobbying that we're doing is just kind of holding us there. And those are the unknowns. That's the list of the unknowns. The list of the unknowns means that there's concern that those funding sources may not even hold steady, let alone keep pace with the cost of doing business.
Jerry?
Looking at back to this issue of out-of-home placements and the unpredictability of that, looking at that budget item for foster care / North Star Care, I'm assuming that which increased by 61%, that dollar amount includes both local foster home costs and the North Star services that are provided that are out of the county, and I'm just wondering how that breaks down. How much do we spend on local foster homes?
We don't have a whole lot.
I know we don't.
Is this a good time to put in the plug for the meeting?
Yeah.
When is that meeting again?
The 17th of September.
September 17th, if you would like to learn about fostering. I know there's a lot of kids that went to college and you're feeling an empty home. You can make your home full again.
This is the child care is what I
So
was
can you.
referring to.
I know. I have two.
Not foster, but childcare is what?
It's a foster, or it's a child care information session.
Okay,
But
it's
our
not-
licensor, who also does licensed foster care homes, will be there and could answer questions about
Yes.
foster care as well. But to answer your question, Jerry,
I don't have a breakdown of what is local and what is not local on that number.
we don't know.
But it does include both.
Yeah, that's what I
Although we
thought.
can say that shelter care, group homes, correctional placements, those are certainly all out of county. We don't have those services available
Right.
locally. But it would be, again, we don't have that breakdown of what's local and what isn't. And then the North Star Care, that is a funding source for family foster care. It replaces what was once called the relative custody assistance. So when there's a transition in custody to a family foster care provider, that's an additional support for them.
So that could be local care of children.
It could be
Mhm.
like a grandma or an aunt.
Sure.
caring for- Or grandpa.
And if I could, just a little more context on the fund balance question, because it comes up and we talk about it and we throw out different numbers. Allison mentioned the 37 or 42%, or the 5/12ths, the 5 months of reserve. And the reason for the recommendation of 5 months of reserve is from January until May is when before we start getting our tax revenue. So 5/12ths is actually 41%. And we have, the only actual policy that we have is that in our budgeting policy, we say that we want to maintain 50% of our operating costs in a fund balance. And that's just a little bit more than that 5/12ths of a 5/12ths%, 42%. And then the other numbers that we throw around are for other purposes, therefore bond rating and that. But so 75% of our general fund operating as reserves, and an overall total of 50% of the county's operating fund balance. And that's largely expressed in the general fund balance, which is one big bunch, and then Health and Human Services and the highway fund balances. And if we spend down the Health and Human Services fund balance and we exceed our costs in one of those places, then we just go to the general fund balance. I mean, we don't not pay the bills, we do. That just comes out of a different place. And having that 42% or whatever that the amount is in highway and Health and Human Services means that in those places where we could have costs beyond our expectations or changes that we can't anticipate throughout the year, they hit those things without necessarily coming back and hitting the general fund. And again, largely that increase from 2016 to 2017 was from unfilled positions. And that's not necessarily that's not a structured, planned way to improve fund balance position. That's just making other people carry the burden of not having positions filled. So just a reminder, there's a lot of conversation about that. I know there have been some specific questions related to fund balance, and I know that Brady is planning on providing some more context as we continue in the budget conversation at upcoming board meetings.
Any other questions?
Besides the unexpected expenditures, also some of the things that we struggle with in creating a budget is unexpected revenues or lack thereof. When we're taking a look at when our revenue sources are coming in, we're creating a budget from January to December. However, the federal government will give us money based on their budget numbers from July 1 of this year to June 30th of next year. How do we account for how much money we're going to be getting in starting July 1 next year through the remainder of next year? And that's also our unknown. With changes in legislature, with changes in what happens in our revenue sources, we don't exactly know how much money we could be getting in. So that's another component I just wanted the board to be aware of, that it isn't always just our costs going up, is that we've got a big unknown with our revenues.
Which is a really great way of showing our difference, government's difference from business. You know, a lot of people will say, why don't you treat this like a business? Well, our revenues don't come in like a business, so we can't. We try to control that.
It is a business because businesses serve customers, and so do we.
Yes, so there are similarities, but not, but we have huge differences as well.
Yeah.
We know that we don't have the revenue to support the need, so we're operating at a deficit each year.
Right.
I know, Jan, you kept saying prevention,
And
which
then
seems
you-
like a harsh word. I want to call it preparedness. We are preparing our community and our families
Yeah.
to handle the worst-case situation the best way they can, which is not an easy thing to do. Myron had your hand up, and then we'll go to Jerry.
Yeah, just to do the business model, and you know, businesses are in the business of making a profit by providing customer service. And we're in the business of providing for the needs of our public at a finite amount of what we can levy or get from support from feds and states. So it's just, and I really like your needs versus wants. I think that's really a good way to succinctly put it, Commissioner Dukirk.
Thank you.
Businesses run on wants and we run on needs.
Jerry?
Just looking at the line for mental health purchase, mental health services, HDC, I see that it's essentially flat for like 5 years, and I'm wondering, I don't know quite how to interpret that. How would you comment on, you know, are the needs flat, or are the available resources flat, or are there services being provided in other places perhaps, or what leads to that being essentially the same number?
It's a complex question, but it's a few different things that I can speak to. As traditionally, that grant was designed to support mental health services that weren't covered through insurance, and with the increased access to medical assistance, the amount of uncompensated care for HDC has gone down. There are also considerations in their staffing as well, that they've had some vacant positions over the last couple of years. Not saying there isn't an increased need in the community, we just haven't necessarily had the staff to support that here. So we've continued to budget the same amount each year for the last several years. We're looking at a slightly different model for next year in looking at what is the need and requesting detailed information from HDC. But for our budget proposal, we're continuing to just budget that same amount.
Okay, good. Thank you. That's helpful.
Any other questions? All right. Thank you all for being here and for being supportive of each other. It's important. Director's report.
Oh, they really need to move over there.
Oh, well.
It's good for your eyes. I thought we needed romantic lighting for the budget.
Jesus.
You can turn it down if you want.
Yellow ones in there.
Don't know where I am.
New light onto this.
Okay.
5.
Yes.
Whenever you're ready, Allison. Waiting for it.
I know it's disappeared. I was had the PowerPoint up, so it'll just take down when I turn. In here, I'll try and keep it brief. I've already spent a lot of time talking this morning. I do have some updates to share. We met Diana White this morning, our new adult services social worker. We're really excited to have her join our agency. The other staffing related items that we have going on is continuing to work with the clinic on discussing the family home visiting program and that potential transition. You'll also notice in our items for board action that we are requesting with regrets to accept the retirement of Joni Christensen effective December 7th, and requesting approval to post her position immediately, again to try and maximize the amount of time that Joni can spend with that individual. And again, this gets back to in our budget presentation, the importance of having a transition plan in place.
And we are required to have a public health nurse on staff, correct?
We are, yes.
So I know that we often get questions as commissioners about, well, when people leave, can you just not fill the position? But this is one of those that.
No, and Joni and I have spent quite a bit of time over the last year really looking strategically at public health services. What are the requirements of the local Public Health Act? What are the mays? What are the musts? And really mapping that out. And that's what brought us to the point of having conversation with the clinic about family home visiting. That it's just really in sync with the work that they're doing with primary care, perinatal care. They're already working with a lot of these families through WIC, Child and Teen Checkup, and that it just makes a lot of sense that this is where we as a small agency, as a small community can get creative and really play on our strengths as a community rather than as an organization. And that by transitioning some of those skilled nursing resources to the clinic, that gives us a little more flexibility in terms of how we could fill the public health position internally. And that is our motivation here in posting this position early and in trying to open it up to a wide range of qualified candidates that could be a good fit for this position. So again, we're continuing to work with the Department of Health, with the clinic, with Joni, and our Community Health Board to really map out that transition. But again, we do have 2 nurses in the budget for 2019. Should that transition not go through for any reason, we are committed to continuing to deliver those services. That's just one of those great examples of where investing in preventative services is improving outcomes for family by intervening early. So some agency updates. Our Wilderness Outpatient Treatment Program is preparing for an audit with the Department of Human Services. I mentioned in the budget presentation that DHS just received federal approval from CMS, the Centers for Medicaid and Medicare Services, to move forward with the substance use disorder reform, or you'll hear it SUD reform or SUD reform. And again, those are additional services and supports for people who are experiencing chemical dependency. we're still learning more about what that implementation will look like for the state of Minnesota, for Cook County. But again, one of the reasons why we wanted to represent that position in the 2019 budget, that as we move forward with planning efforts, as we get more information from the state, that we have the ability to add that staff person, be it mid-year or in 2020. And we met as a group, the CD team, so that includes our support staff, fiscal staff, treatment staff, everyone who's involved with the big picture of chemical dependency services in Cook County, or within our agency at least. And we used a swim lane diagram. I had that opportunity to go through the lean training a couple years ago when we had it. And that was, again, our work to try and find efficiencies, and where are we getting slowed down? Where are there gaps in our services and our processes to make sure that we're delivering the best services possible, and to really demonstrate that need for additional support staff. Cook County Public Health and Human Services was recognized for receiving 96% or higher timeliness in the SNAP program. That's a Supplemental Nutrition Assistance Program. So I'll route this certificate around. This was for the period beginning January 2018 and through March 2018. And a 96% or higher timeliness rate means that 96% or more of the applications that we received here in Cook County were processed within the required timeline. And for the expedited SNAP, that's for people who have an emergency need for food, that's within 5 days. Often we try and do it same day or next day here in our office. And then for any other request would be within 30 days. So kudos to our income maintenance team for meeting that requirement. And we also received notification from the performance management system. This is an area within the Department of Human Services that measures counties' performance to ensure that agencies are meeting the threshold for performance for various measures. The report that we just received was related to child safety and permanency, and the MFIP and DWP programs. Those are some of the cash assistance programs for families who are transitioning back to work. And in that report, we again met or exceeded all performance measures for the time frame, and that was 2017 year end for the child safety and permanency, and April 2017 through March 2018 for the self-support index for family cash. And the self-support index measures people's ability to transition to work and not have to return to assistance. And we were within the performance expectation for that measure. And then some of the child safety and permanency measures include percent of children with a substantiated maltreatment report who did not experience a repeat maltreatment report within 12 months. And another measure would be the percent of days of children in family foster care spent with a relative. And for that measure, Cook County showed marked improvement in having 74.9% of all placements with a family foster care with a relative. And that exceeded the regional and state performance. So again, kudos to our Children and Family Services team for the great work that they're doing with families. The Early Childhood Coalition has reconvened. There's a lot of energy around childcare right now, which is exciting, and we're happy to be a piece of that continuum of care for kids in the community. We've had representation, I believe, at each of the meetings so far. Joni attended last night. I have yet to connect with her to get her updates, but again, we're excited about the energy and doing what we can to support efforts to meet the needs of children in the community. PHHS, as we mentioned earlier, is hosting an information session, and that's on Monday, September 17th from 4 to 6 p.m. in the Log Cabin building at the community center. And we have some flyers that we're routing, and that's available on our Facebook page as well. We met Monday with the Public Health Community Grant Review Committee to review some of those applications that came through for 2019 funding. And we had a lengthy discussion. We completed a ranking of all of the applications. We received a couple of new applications this year, but many of the same people who have historically requested funding. And we're going to have to set up an additional meeting to make some of those funding decisions. And that is all that I have for updates from the agency. If there are any questions before moving forward.
Myron?
No, thanks for all you're doing. No.
Jeannie?
Nope, sounds great, especially thinking ahead to transition to the clinic for the in-home visits. I think that's a good move for you to think about.
Jan?
Thank you. Great report.
Jerry?
Yeah, just a comment that we have a strong advisory committee, and it's feeling very positive about the agency and how things are working. I think that there's a real positive sense of support in our committee about how things are going, and we're eager to stay tuned and work with you all.
All right, let's move on to board action. Would anyone like to make a motion?
I would move to request, or to accept the retirement of Joni Christensen on December 7th, and request for approval to post vacancy for Public Health Coordinator effective immediately.
Support.
Okay, we have a motion, a second. Any discussion?
Regrettably.
Regrettably.
Mm-hmm.
Any opposed? All in favor?
Aye.
Passes. Oops. All right, we will move on to committee reports. Arrowhead Economic Opportunity, Myron.
Yeah, I guess I'll just comment that maybe it's sometime next year we should have a discussion about committee assignments, but I've developed conflicts. This is every other month on a Thursday, and something came up last time Ginny was able to go for me to attend a meeting because I had conflicts, and they no longer accept alternates on their board to vote and participate, so she didn't go. So consequently, I followed up with AMC, Association of Minnesota Counties, and asked about this as what's happening with this. So they did some research, and I appreciate that because they've done that for me on other areas of concern. And it's not necessarily in statute now, but it is being recommended as a best practice. So, someday down the line, I don't know, we may have to deal with this, especially with some boards that don't accept alternates. And then the issue is, are we represented or not? And I've missed about half of these just because I have to prioritize. And they have a lot of board members. So one time I got a call, I just tell them, well, call me if you need me for a quorum. And one time I went, because, but they have a lot of board members, but sometimes they get short on the quorum too, so.
So it is not unique for a committee to not allow an alternate to vote?
It's becoming recommended as a best practice. And one of the questions that I talked with Jim Carlson, who's the executive president of AEOA, and he said that they have been developing new bylaws and so forth, and so when they do this, they're starting to look at best practices. And I guess the issue is, can someone really represent someone else? Because you haven't been there in the context of, a lot of other boards are not doing this at this point in time, but it may be happening as they revise their bylaws. So I guess that answers it more specifically.
But what I'm saying is this is not unique. it has been this way since I've been elected. We have committees where they do not allow the alternate to vote. We send the alternate just so the alternate can bring the information back or let the primary know what happened at the meeting. So it's not unique for Arrowhead to do that. And we do set committee members at the first meeting in January, but we always allow for a change at any time in the year by motion. So if you feel you need to step down or step back from Arrowhead and us reappoint, it's a motion, it's sent to Arrowhead,
Sure.
and then that person is
Yeah,
the
no, I
voting member.
understand that, yeah.
So if you want us to do that, we can do that earlier than January.
No, I don't think so. I think I'll just try to go, and the point being that this was a change for them.
Yep.
And so, according to AMC, most boards allow alternates, but it's changing, that's all. That's my point.
Okay. Arrowhead Health Alliance, Jan.
Thank you, Madam Chair. We did not meet this month, but I did get an update from our Executive Director, Rick Schaefer. And the Region 3 Adult Mental Health Initiative has changed its name to the Arrowhead Behavioral Health Initiative. This name connects more with the Arrowhead region, so a word, an idea versus a number. It's a better geographic description for most people than Region 3. It also removes the word adult, which is not quite accurate anymore, as our crisis grants are serving children a lot more. And finally, it is more in line with current terminology around mental health and chemical dependency, as many organizations have adopted the term behavioral health. And so the Arrowhead Health Alliance is also working with Giant Voices to develop some marketing, some branding, which I guess, sounds weird for government organizations, but we all need to do marketing and branding, et cetera, if we're going to be more effective. I think that's one thing government can learn from business, that sometimes that works better. Census reports that both Range Mental Health, the Wellstone Center, and Thrive, the Birch Tree Center, are trending higher for the census in 2018. So I think they had been operating at the capacity, at 50% capacity or occupancy, and now they are averaging 56% occupancy, which is a positive and a negative. There's higher need, but we have the capacity, so that's the intention, was to serve that capacity. The Clarity Project, which I've spoken about before, is the project that's really centered around, Duluth or St. Louis County is sort of at the hub of that. And a lot of organizations are involved, law enforcement, the medical centers, Essentia, Miller Dwan. Is it Miller Dwan? Is Miller Dwan part of Essentia now? Anyway, St. Luke's, they're all collaborating to create this hub or triage center. And so the Department of Human Services is about to release an RFP outlining the process for applying for the state-approved bonding dollars, which were just allotted. And AHA has been asked to become the fiscal agent for the sole purposes of contracting with the Clarity Project. And the Miller Dwan Foundation has funding they would like to award to the project, and will be awarding those projects to the Arrowhead Health Alliance as a go-through. Let's see, they're still working on telepresence. They're going to be changing the office space. And the big news for the Arrowhead Health Alliance is they were at the State Fair yesterday. So it was the first mental health day at the State Fair yesterday, August 27th. And so I don't know the outcome, but they were going to have staff there talking to people all day. And that, I think, is a new marketing idea to bring mental health awareness to all people attending the State Fair.
I hope they were next to the cookie stand, because cookies make people feel better.
Well, yeah, he was going to offer anybody who showed up something on a stick. So cookie on a stick, maybe. Yeah. That's it.
Thanks, Jan. Arrowhead Regional Corrections, Bobby?
Well, we voted on the budget last meeting and it passed. And the one thing I find interesting with NERC up there is we've had one person in there in the last 8 months. I don't know if we're not utilizing the services there.
No, we're preventing.
Yeah, we're working on preventing.
Well, I don't know about that.
Is it happening?
But we've had one person there in April, and that's it, Cook County has.
That's good, I guess.
You could
Yeah,
ask Pat about that.
well, yeah. I don't know if it comes down from the probation officers with, when you do your pre-sentence investigation, they recommend, you know,
Do you know what the context of that is? I mean, is there normally more? Is that kind of normal? Do you know that?
there's
I'm
been
just
like one
curious.
person since I've been on that board for a little over a year,
Okay.
so.
Interesting.
Yeah, I could just comment too that I was on it, for a year. And half a year longer, and it's been sort of that trend. And our costs are pretty much proportionate to use. They have a formula.
Yeah.
But that's, it's an interesting question maybe for them to investigate more. But it is good news to some extent.
You could hypothesize that if your probation officer is doing a good job, they would tend to keep people out of NERC.
Yeah,
Right.
exactly.
I don't know how much weight that carries, but it could be a good sign.
And
Yeah.
I've asked our probation officers in the past, and I see both of them at the Y once in a while, so I talk to them when we're working out, and, and our severity of cases here are not at the level as they can get in other counties. Just because I think our remote area, and then sometimes we don't know what's going on either, which it could be, we're remote and we don't, there's a lot of land out there to do certain things, but I don't think that's statistically significant, or at least I hope it isn't, but I know they've commented that, we don't have that element of gangs and, sophisticated drug dealing that's more, isolated, but maybe more's going on than we know. I don't know.
Is that it for your update, Bobby?
That's it.
Thank you. Community Health Board. Let's just say the most important thing is the acknowledgement of Frankie Jarko as our Citizen of the Year. She sits on that board with us, with Joni and Allison and myself, and so that was a recognition. I did have to leave this meeting early to go meet with the representative from the Bloodmobile, because we're having a Bloodmobile here in the county parking lot, so you will get an update on that. And we are trying to set a date for strategic planning for the health board. And then we had a presentation. Anything else that this board needs from that meeting? No. All right. Public Health and Human Service Advisory, Jerry.
We did not have an August meeting, but we will in fact meet next week.
Great. Healthcare Planning Committee, Ginny.
Yes, we did meet, and Rita was very pleased to announce that we have a new doctor coming into town. Dr. Stover has retired and had her party already, which I missed.
Holy cow.
Yeah. So this is...
No, she's got,
She doesn't?
no, the clinic is doing a,
Oh, something...
September
It's on the
22nd?
25th.
Oh, okay, so it's coming. Good.
Of
Okay.
September?
Is it the 22nd or
Good.
25th?
oh yeah, we got a couple
Yeah,
different
you.
dates.
So Dr. Catherine Hansen will be coming on board.
Great, thank you. North Shore Collaborative, Jan.
Thank you, Madam Chair. So Karen Tucker, our current lead person, our paid staff, she's not an executive director. The budget has shrunk so much that they stopped having a executive director long before I was on this committee. So the transition plan will be, well, did I say she's retiring? Karen Tucker is retiring in December. So as of January 1st, we will be without a administrative assistant or whatever. But, so Lake County came up with a fabulous plan, and they will be coordinating the duties of the North Shore Collaborative beginning January 1st, 2019, with a review at the end of the year. which will result immediately in a net savings of $3,000 just on liability insurance alone, not having to have a separate policy under a separate organization. This person can be covered under the Lake County's liability insurance. And we expect there'll be some other streamlined operations. We can get rid of, I guess we have a couple of bank accounts. Those can be gone away. Our bookkeeping will be streamlined. Karen was doing separate bookkeeping for the collaborative, and that now can be done under Lake County's normal processes. And I think, we've talked a lot with this board about all the meetings that we go to. So I think another aspect that may be streamlined with this new transition plan or in the new way would be that we would have quarterly meetings. And I don't remember, Allison, if I wrote that down as a wish or if that was actually talked about. But I wrote down quarterly meetings as a wish. And it might have actually happened during the meeting. But we have streamlined just the every other meeting, or 2 meetings a year are being done telepresence. And that has worked really, really well. So bringing all those people from all directions to a location we bring all those people to closer locations at least twice a year. So we're working on streamlining as the budget decreases and still be effective and get the monies to help kids be healthier and read more, et cetera. So still trying to accomplish the mission without all the effort on behalf of so many people. So be more effective, save some money, or maybe divert the money toward the kids where we want it to go.
Yeah, telepresence is another
Yeah.
issue that has to be addressed in bylaws, because not all committees accept voting from a telepresence. So,
Wow.
yeah, lots
Yeah.
of things coming up in our future that we have to
Yeah.
address.
And I just say, solve it. It's just so like you're there. It just feels like you're there, particularly depending on the quality of the equipment. But the quality of the equipment at the school is really, really, really good. And the quality of the equipment here has gotten.
The owl upstairs is
The
fabulous.
owl, yeah. I think is it an owl at the school too? I don't know. Anyway, felt like we were all together in one room.
Great, thank you. Ginny and Myron, emergency preparedness.
Yes, we had a long one. And before we went to the long one, we had another one at home. We were doing a 3-hour course on the computer about all of the different aspects of emergency management and who's in charge of what. And then we came as a group to do another almost 3 hours emergency preparedness. So are we prepared? I hope so.
We got one more to go.
They're like 200, 700.
Incident Command Center stuff,
400.
yeah.
Yeah.
Which I think
Fabulous.
Commissioner Dukirk has gone through that.
Yeah.
But I think we've got one more shot, and then we're
Then you're experts?
certified. No, we're
Okay,
certified.
fully certified.
Just certified, I don't know about expert.
I have fire department training tonight, so I get regular updated training on my IC commanding. It's very interesting.
Awesome.
All right, that is all the committee reports. Would anyone like to make a motion to adjourn?
I will do that.
Bobby?
I'll support that.
Awesome. All in favor?
Aye.
Thank you. Is anyone heading over to the hospital for the program today? Mental
No.
Healthy Community Initiative? Okay.
I've never
I was
heard of
gonna
it.
try and make it. Oh, we all got an invite.
Oh.
Yeah,
Did we?
I thought
Yep.
this-
But it's
That
a
was
long,
in the-
it'd be a great thing to do.
yeah, I'm gonna try and make it over there.